First
Yeah,
time.
do you want me to speak first? Are you good with the scissors?
Yeah.
Okay. All right, well, thank you so much for being here with us today. I'm Rebecca Curran, the Regional Operations Manager for Achieve TMS Central. And we're really excited to be having our grand opening of Achieve TMS Central here in Ankeny, Iowa. Thank you so much to the Ankeny Chamber of Commerce for your welcoming support into this community. We're really excited to be providing this service in Ankeny and to the Des Moines area. And I'd like to thank Angie Harris, Regional Marketing Manager, who's behind the camera today, for everything she does to put all of this together. We really can't even imagine. So I'll take a minute to introduce our team here. This is Elisha Coker. She's our TMS technician. Elisha's education and hands-on experience in behavioral health care has really made her an incredible asset to our team. Judy Hager is our psychiatric nurse practitioner. She's very experienced and knowledgeable in TMS. And Dr. Butt is an adult and child psychiatrist here in Des Moines. He's incredibly knowledgeable and well respected in the community, and we're very grateful to have him as part of our team as well.
All right, thank you. Perfect. Let's pose with the scissors open.
Okay.
And if we can get Dr. Butt to scooch in just a little bit so we can see everybody. All righty, we're going to pose first. And on the count of 3, we're going to cut. 1, 2, 3. Yay! Wonderful.
Thank
and we're going to
you.
follow you around for a quick little tour.
Sure. Do you want to have Dr. Butt and Judy say a few words before we get started on our tour?
So, good afternoon. I would like to personally thank everyone for attending today, and I express my dedication and commitment to the Ankeny and Des Moines community. The mission of all of our dedicated professional team is to provide a high quality care in a relaxing and comfortable environment in collaboration with community providers. I have practiced adult and child psychiatry as well as ECT in this area for many years, and now I look forward to also providing brainwave Deep TMS, that is a relative, non-invasive, state-of-the-art treatment for resistant major depression in Ankeny area. At this time, I would like to introduce Judy Hager, psychiatry nurse practitioner.
Thank you, Dr. Hello, I'm Judy Hager. I'm a nurse practitioner here at this location. I also oversee our location in Mason City. It is such a pleasure to have the welcoming committee here with the Chamber of Ankeny. I'm very excited to be a part of this. As a nurse practitioner, I've worked in varied fields with natural TMS. I've seen some remarkable results with this, and I'm so excited to be able to offer it in the community here. Thank you.
Thank you. Okay, back to Becca.
Do you want me to do this?
Yes, if you don't mind, that would be great.
All right, so I'll tell you a little bit about TMS. I know you guys had some questions and weren't quite clear, so I'm just going to kind of start with we really go into the population we serve. So we're a mission-driven organization helping people suffering with major depression. And we like to collaborate closely with community providers. Like Dr. Butt said, communication is key, and we definitely need to work together as a community to increase the resources available for people suffering from major depression. The population that we serve, like I said, it's adults suffering from treatment-resistant depression. So these are some statistics that 1 out of 6 Americans in any given year will suffer a major depressive episode. And so that's about 6.7% of adults in the U.S. in any given year. And of these 6.7% of adults, about 32% are resistant to any medication treatment. So it's really these 2% of adults that have treatment-resistant depression that we really target to. And what this shows is the likelihood of achieving results in remission after your first line of treatment with medication that each successive line of treatment you have less and less likelihood of achieving remission. And you can see here that a depressed brain is functioning differently than a healthy brain. There's changes in blood flow and brain metabolism, reduction in number of neurotransmitters. So in major depression, there's certain structures in the brain that have been identified as key players. Certain areas are hypoactive, and those are in blue, and then other areas can be hyperactive, like the anterior cingulate cortex in red. So what TMS does is it promotes the release of neurotransmitters. So it uses magnetic pulses. In treatment of depression, the magnetic pulses are to the left prefrontal cortex, which then stimulates all the way through this entire circuit to the deeper structures of the brain and then back up. And like Angie was saying, TMS is not as new as it seems to our area. It's been FDA approved for surface TMS to treat major depression since 2008, and deep TMS has been FDA approved to treat depression since 2013. So really it's just new to our area. It's not new for treating depression. So there's the two types of TMS, and I'll just explain a little bit about them. So surface TMS uses a figure-8 magnetic coil, and it can penetrate about 2 to 3 centimeters in depth. And we're using the BrainsWay Deep TMS here, which uses an H coil, and it penetrates 4 to 6 centimeters, so about twice as much. So you can stimulate those deeper structures in the brain. Yep, and the deeper structures in the brain have significantly more connections with the underlying mood circuits. And the deeper stimulation produces better treatment results. This is a comparison. What you can see in blue is the response rate, and red is the remission rate. And here on your left would be the deep TMS as compared to the surface TMS on the right, with results and remission rates. So it is, the deep TMS is getting better results with treating major depression. There was a study done in 2018 that was released in 2019 where they did about 200 partial hospital patients, and they did 3 different groups. There was the deep TMS, the control group, and the surface TMS, which is the figure-8 coil. And the results that they got after 4 weeks of treatment with deep TMS was a 72% response rate. With the surface TMS was a 44% response rate, and with medication alone was a 26% response rate. So we're seeing some really good results with treating depression. And then this is the remission rate, which is still very good, 64% with the H1 coil and 43% with the figure-8 coil as compared to 12.5% with medication alone. This speaks a little bit to the research really hits on the frequency and the repetition of it being key to TMS working. It's kind of similar to exercise in that, you know, you can't do it once and get the great benefits of exercise. It's something that you do again and again, and then you reap those rewards over the long term. So over 20 sessions, you can see the remission rate in green and the response rate in blue as compared to 30 sessions is significantly higher. So the frequency and repetition is really important in training that brain to be more active and release more neurotransmitters for the longer term. The referral process is very easy. Providers can refer. We have a provider portal on our website. Patients can also self-refer. It's very easy to connect with us, and you can send an inquiry and we'll get back to you. And then of course we do communicate with your providers just to set up a comprehensive treatment plan and have that collaboration between us. And it starts with a free 30-minute informational session where we explain how TMS works, what the criteria is for your insurance to cover it, what the risk factors may be, and go through that with each patient so that they understand. And then the next step is a psych evaluation. And from there, we determine if TMS is the right treatment course for you. And then at that point in time, we would go ahead with the cortical mapping, and then treatment would begin immediately. And what the cortical mapping is, obviously each person's head is a little bit different, just like our bodies are. So we map each person individually, and we'll go through the mapping here in a minute with the cap and finding there's a measuring grid on the cap, so you can find the right coordinates for each person. And what we're looking for is a motor response in the right thumb. And then there's an equation that's used with people's head size and things like that taken into consideration as well to find the best treatment location from there to treat for depression. And we'll show you a little bit in the treatment room so you can see the mapped location where they get a good movement in my right thumb, and then moving forward to the treatment location where we would treat for the depression. The treatment regimen is, like I said, it's the frequency and repetition that really makes it work. It's 30 treatments or 5 days a week over 6 weeks, and then it tapers down 2 days a week for 3 weeks. The treatment itself only lasts about 20 minutes, so your regular appointment only lasts about 30 minutes. Obviously the cortical mapping and the redeterminations, which is kind of a periodic remapping to check on those things, those appointments take a little bit longer, but it's really a pretty quick appointment, in and out. Pretty non-invasive as far as you can come and go, you can drive, you can go to work, you can resume all your normal activities. There's no systemic side effects like there are with medication. No adverse effects on cognition. The most common complaints are from the treatment itself: neck pain, headache, minor fatigue, and those usually diminish as people kind of get used to the treatment. There is a low risk of seizures with TMS, so we do talk about that, and that is part of our questions as well. Anybody with a history of seizures or epilepsy, we do look into that and definitely work with the providers. But it's only been a 0.1% in the post-marketing period, so it's really a low seizure risk, and we do our due diligence to make it safe for all the patients. This just is a little comparison of side effects from different treatments, and with TMS, really the headaches and the fatigue, lots of systemic side effects with medications. ECT is another effective treatment for TMS, but it's a little more invasive, where you have to go into the hospital and be sedated, and there's just more with it. Just brief period of memory loss, that's typical with that as well, and that doesn't come with TMS. So contraindications, really any type of metal other than dental implants in the head or the neck. Pacemakers, a lot of the newer pacemakers is actually okay with TMS because it's far enough away, and the types of metal that they use now. The history of seizures that we talked about, substance abuse that would lower your seizure threshold, and also neurological conditions that would increase your risk. We don't treat people with dementia. Not that TMS really has any effect on dementia, but just for it doesn't help with dementia either, and it can kind of be a stressful situation for those people to be in. And as far as pregnancy goes, really there's no studies to support that TMS is safe for the unborn child, so we don't treat during pregnancy. We do work with most major insurances, and we're definitely working to get on with the ones that don't currently cover TMS, so we do work hard for that. And honestly, if people have an insurance that isn't listed there, we'll definitely try to set up some kind of working agreement with that insurance company. We're definitely patient advocates here, and we try to get this service available for our patients. I know Judy touched on this a little bit. They are doing research on using TMS for lots of other things. Right now, TMS is approved to treat major depression and OCD. They're doing studies on treating bipolar, nicotine addiction, opioid addiction, and also PTSD. So, yeah. It's pretty exciting. Like I said, we're very patient-centered. Excellent patient care is really our goal here. So offering this groundbreaking technology of Deep TMS, which is having great results in people with treatment-resistant depression, and our excellent patient care, our communication with providers. We don't have any waiting list, and we handle all the insurance and authorization part of it. Flexibility of hours, we try to be very accommodating to our patients too, so that they can come, you know, either on a break from work or before work or after work, carry on with their normal lives. And obviously it's a kind of a comfortable atmosphere. Patients can just watch Netflix while they're having their appointment and just relax. So the COVID-19 safety guidelines, we have increased quite a bit of our cleaning and social distancing. The social distancing really was pretty easy for us, since we do just see one patient at a time. We just built a little more time into the schedule for more thorough cleaning and to avoid having overlap, so people are waiting in the waiting room. And of course you can always wait in your car and we'll text you when to come in. So that's been pretty easy to accommodate for us. And then just the thorough cleaning in between. We do offer telehealth appointments for with the providers pre and post treatment. Did I answer your questions about the treatment?
You did. I was extremely impressed. I was going to ask about side effects, and you went right into them. So,
yeah,
excellent job.
Yep, really not very many side effects, just the discomfort from the treatment itself.
Right, wonderful.
Thank you.
Yeah, absolutely. Thank you.
That was very well done.
Yeah. So if you're all ready, let's fire up the machine, show everybody how it works.
Yeah, I think she's got it all fired up actually on her phone. I think what I'm going to do is move this chair.
Oh, I don't know if you want me to, how you want me to rotate it.
However I can fit under there.
Like
so there's-
towards there? That towards the doorway?
Sure.
Okay.
Yeah, I can squeeze me in however. Okay. All right. And I actually do quite a bit of training, so I've been mapped several times. So we don't have to go through the whole mapping process on me. They already know my my coordinates. I guess that I need to take my hair clip out and put in a detailer. So pardon my hair for a minute. Yeah. Okay. And so, and my most recent motor threshold was 52, so we'll just go with that.
Okay. So before your mapping and before every treatment, we have a cap that's assigned to each individual patient. You don't have to worry about sharing it or there. This grid helps to find the treatment location. The tech puts it on. Make sure it's straight.
Rebecca's one of our finest models.
Yeah.
And during, I don't know if you mentioned this, and maybe you did, I apologize. During the initial mapping, the psychiatrist or the nurse practitioner is here overseeing that part of it. After those coordinates are determined and treatment levels are set, then the technician goes ahead and does the treatments moving forward.
We remap every 10th treatment so that we can
Yes.
make sure that those
Yep.
coordinates stay the best treatment placement.
Just a smidge moved up when I pass it.
I didn't hear you, Judy, but I think you said we remap every 10th treatment, correct?
Yes.
Okay, great.
Yep, and the techs check the motor threshold too, more frequently, just because that can fluctuate quite a bit, just based on lack of sleep, amount of caffeine intake. Definitely stress levels can affect that as well, so. Yeah.
Motor
So-
threshold means what?
Let's see, you have an area in your brain where if you're stimulated,
You wanna
you
hold
get a
this
motor
closer?
response. And what we look for is the best motor response, and then after we find that, after we move it around the grid, we find that place, then we determine what's the lowest frequency that we can use. So what we try to do is isolate it back over, maybe that'll make it a lot easier. So if we want to watch the right hand.
So we've backed Becca before, and we know that her mapped location for her motor cortex is at 7 level. Is it there?
I just pulled it down a little bit.
We also know that Becca's motor threshold, so the least amount of power that still yields a 50% response, is at 52. So what we're going to do is we are going to charge a pulse, and we look for a response in the right hand. The greater the isolation of the thumb response and the stronger the reaction, we know that's how we know we're close to the motor cortex. So 3, 2, 1, pulse. I'll do another one.
It might be a little lower today.
Bit lower.
Yeah, like I said, I had a big hand response,
Okay.
but who knows, yeah.
3, 2, 1. Yeah, so that's a fairly large response without a lot of thumb isolation. Do you want me to go down, or would you like me to move on to show them the treatment location?
I would turn down a little bit and show them that they can, since we're determining the motor threshold, that we can turn it down and get a response. Like I said, lots of things affect it, so probably all that coffee I drank on my way here might have.
So I turned it down 5. So now the power is at 47 at 7 level. 3, 2, 1, pulse. Still saw a fairly large hand movement instead of isolation of thumb. So I'm going to turn it down even a bit more. Three, 2, 1, pulse. That was more of just a thumb isolation, so we know that her motor threshold is probably closer to 44. So we would go through with the patient and we would test to see if there's a 50% response getting the thumb movement. Do you want to leave it at 44 for now?
Yeah, that's fine.
Okay.
Just leave them on time. But yeah, the lowest intensity that you can get a 50% response is your motor threshold.
Okay. So her motor threshold was 44. We start the first treatment at 80% of your motor threshold so that the patient can get adapted to how the treatment feels. We eventually want to work up to 120% or however much the patient is able to tolerate. So for Becca, 80% of her motor threshold would be at an intensity level of 35.
Which is a great starting point for patients. Yep.
We typically want the first treatment to be in the 30 range.
Yep.
Her treatment, so this is where her map location is. Her treatment location based on 7 level would be 1. However, we don't want it to go below the brow line. So in Becca's case, the lowest we could probably go is a 2.5.
Mhm.
It's the doctor who ultimately makes the decision of the treatment location. All right.
Do you want me to do
chin strap. We can,
Do you want to?
yeah, and then you can run a cycle so they can hear it. Am I straight or am I twisted? Yeah, it's twisted.
Make sure that it stays in the correct treatment location after implanting it. So we're still at 2.5. Just a smidge, so it's straight.
What you can't see very well, but there's a little plastic grid.
Oh,
Piece on the
yeah.
front where she lines that up with the grid
I
marks.
see, yeah, you can see that clear piece of shield.
All right. So we are going to run. You just want the one pulse?
The one cycle,
Yeah.
Yep.
For that adaptation.
yeah, one cycle should be fine.
So this is one cycle for a typical treatment. How many cycles are there again, Becca?
It runs 55.
And so that's just one cycle. So a full treatment for the daily treatments would be 55 of those with about 20 seconds in between.
Is there a magnet then going against her head?
That's
No,
pretty
it's
much
like
it.
added on the
Thank
inside,
you.
And then she has the back.